Hello, my name is Paganou Sabbina, and I am a PhD candidate at the Department of Management, Science and Technology at the University of Western Macedonia, which is located in Greece. Dear participants, today I'd like to talk to you about my study entitled Virtual Healthcare to Health Organizations in Greece during the COVID-19 pandemic. Let me give you an overview of the presentation. First, I'm going to talk about introduction. After that, we'll be taking a look at theoretical background. To add to that, I'll determine the definition of the virtual healthcare and its benefits. Then I'll explain the research questions and the methodology of my study, and after that, I'll provide the results of my research. Finally, I'll mention my conclusions and the limitations of this study. Let's begin with the introduction. The present study attempted to investigate the view of Greeks about virtual healthcare in the conditions created by the global pandemic of COVID-19. This view is explored in two dimensions. The first refers to the dimension of perceived quality and the second to the perceived level of difficulties encountered in its application. Data were collected using the European Union questionnaire for acceptance of virtual healthcare to achieve the optimal level of health, known as Health Optimum, following variety proposed by Vidal Alabal et al. 2020. The sample consisted of 152 individuals and its responses were analyzed using frequency tables, cross-tabulation tables, X-squared tests of independence, and Spearman correlation analysis. Now we'll move on to the theoretical background. An important advantage of virtual care is the saving of resources. Healthcare systems are dealing with an aging population affected by chronic diseases and social care needs that will lead to increased requirements for health services. Such a phenomenon could lead to a lack of resources and undermine healthcare services to patients. On the other hand, there are also studies that have shown that doctors overemphasize potential barriers to benefits with the lack of financial incentives and resources, interoperability and regulatory frameworks for confidentiality and privacy being considered the main obstacles. Now, let's look at the definition of the virtual health care. The use of telemedicine and home care has been proposed as a method of continuous health care for patients. Studies have shown that an online session with a doctor can be effective even in relatively complex medical cases, including reduced hospitalization time and fewer deaths, while saving time and cost for patients and access for the elderly, people living in geographically remote areas, and people with disabilities, as well as helping to prevent the infection of infectious diseases for both patients and staff. Now I'd like to discuss the benefits of virtual healthcare. The positive assessment of virtual healthcare relates to the benefits attributed to it which arise from international literature and include the following: allows continued care even in periods such as the current pandemic, offers greater convenience. It is more tailored to patients, their families, health professionals, and health organizations. A virtual session with a doctor can be effective even in relatively complex medical cases. At the same wavelength, participants recognize that the difficulties encountered in the implementation of telemedicine sessions vary to moderate level. Now let me turn to the research questions. First research question: what is the level of quality citizens attribute to virtual health care during the COVID-19 pandemic? Second research question: do citizens recognize difficulties in implementing virtual health care? Search question 3: what are the demographic or social factors that influence the level of quality in virtual health care? Let's continue with the methodology. This paper conducts a literature review studying the following keywords: virtual healthcare, telemedicine, and technology acceptance model. In the context of the present value, a structured questionnaire of closed questions was used in the format suggested by Vidal Alabal et al. 2020, while its analysis was done using descriptive and inductive statistics with the software SPSS statistical program. Specifically, the researcher uploaded the survey questionnaire to the Google Forms tool and invited the entire social circle to fill it out. Thus, about 256 people were invited to participate in the completion of the question, of which 152 responded to the call, forming a participation rate of the order of 59 and 375%. Now I'd like to discuss the results of the 3 research questions. We can see the results of the first research question. The sample generally shows a very positive picture for virtual healthcare in Greece, since it considers the quality provided at least satisfactory. In particular, at least 1 in 2 participants rate as good or very good both its overall quality and its technical quality, while almost 7 in 10 say that they feel comfortable during its sessions. Moreover, with regard to the future of telemedicine, less than 2 in 10 claim that it can worsen the health of patients, while almost say it will improve it. After that, we'll be taking a look at the second research question. The difficulties identified in the implementation of virtual healthcare during the COVID-19 pandemic are rated rather as moderate than high, with 7 out of 10 reporting that they have faced technical, organizational, or other problems only occasionally. Therefore, both technical and organizational difficulties are treated to the same extent and evaluated in the same way. This may also be due to the high intention of continuing to use telemedicine in the future, as less than 1 in 5 say they don't intend to continue to use the services of virtual healthcare after the pandemic. Then I explain the results of the third research question. The perceived quality of virtual healthcare appears to be significantly influenced by some characteristics of participants. Firstly, women, although they report higher levels of comfort against telemedicine sessions, are at the same time more reluctant to use it, as they prefer traditional healthcare to virtual. Secondly, those who believe that the COVID-19 pandemic will lead to a long-term increase in telemedicine use don't believe that this will also benefit the health of patients. On the contrary, it is believed by those who don't believe that the COVID-19 pandemic will lead to a long-term increase in the use of virtual health. Now I'd like to discuss the conclusions. Virtual healthcare is evaluated positively. Positive evaluation is higher for women, people with prior telemedicine experience, and healthcare personnel. The perceived level of difficulties in its application doesn't differ depending on the demographic or other characteristics of the individual. Finally, the study presents some limitations. Thus, it is proposed in future research to follow sampling methods that lead to more representative samples, such as random samples. It is necessary to look for demographic or social factors that are likely to influence the level of difficulties preserved by the Greeks in the implementation of virtual healthcare. Finally, it is important to explore possible interactions between the quality that Greeks attribute to virtual healthcare and the difficulties that they recognize in its applications. Thank you for your attention.